So in this case, when we do the optogenetic stimulation of the PV neurons at the GPE areas, you can see we are recovering the percentage of the contralateral touch in the rats, right? More towards the healthy case, and it does last for some time, like at least for 15 minutes, right? So it does has some therapeutic effects, and especially if we compare that with just doing optogenetic stimulation without nanoparticle ultrasound with implantation of fiber, the effects are very similar with our optogenetic approach, right? So it's really showing our efficacy of our technologies similar to optogenetic neuromodulation for treating of the Parkinson disease. And here's another behavior we are running is that with this Parkinsonian model, the rat will keep rotates, right, when we put into the cylinders as well, when we inject the ibuprofens. But then if we do the neuromodulation, right, so we can see it really reduce the amount of rotations. So you can see with the Parkinsonian rats, the rotation speed is very high. With healthy rats, it's very low. Rats don't normally rotate, and then if we do our optogenetic stimulation, really reducing the angular speed, and the effect is also very similar to what we do with optogenetic stimulations. So it has a similar therapeutic effects as optogenetics. So yeah, basically that's a demonstration of our technology for optogenetic neuromodulation in the diseased rats.